Body contouring has to do with reshaping. Usually we're saying from the neck down, from the neck and trunk. Sometimes when you're doing the body contour of the lower of the abdomen and trunk, it's with a tummy tuck plus the liposuction, because the areas that you treat, you want to make them congruent. So you wouldn't want to have a flat abdomen with rolls of fat along the back. So we try to make sure that the patient's congruent. So you do the tummy tuck and you're going to do the power. I use power liposuction to suction out those fat deposits to get the patient to be more even. A tummy tuck's an open procedure, meaning that the patient ends up with a large incision is made for you to tighten muscle, remove fat, and then remove excess skin. So it's a different procedure. Not every patient who needs liposuction is a candidate for a tummy tuck, and vice versa. When you explain that the length of the scar may be long, the quality of the scar may change over time, things like that, you have to see what their level of commitment is with regard to an open procedure. We call it an open procedure, a procedure where you have to remove fat, tighten muscle, and then kind of reclose an area. But you do educate the patients, and then some patients just will say, you know what, I know that I wouldn't be able to tolerate the recovery of that, so I can't do it, or I don't have time off from work to be out for 10 days, or I can't do that. So it's important to educate the patient with regard to the contouring. You want to have a very aesthetic silhouette, is how I think of it. Let's say that you couldn't see a person's face, but they're standing before you and you look at their shape. To me, body contour is that. It's basically trying to define a person's silhouette, and it could be in any clothing type to have a certain aesthetic to their physique.